Bonjour à tous, welcome to all. Je suis Boris Proulx, journaliste au journal Le Devoir, et je serai le modérateur de cette conférence de presse. We have today two members of Parliament, Green MP Elizabeth May and NDP MP Alistair MacGregor, and a few guests that I'll let the members introduce later on. We'll have a question period. I'll take questions from the room and then on Zoom. So if you're attending on Zoom, please use the raise hand function at this moment. Sur ce, Monsieur, Madame les députés.
Much, ladies and gentlemen of the press, happy Valentine's Day and good morning. And thank you very much, Alistair, MacGregor, and Elizabeth May for joining us here. I'm here with Dr. Valorie Masuda and Janis Hughes. My name is Spencer Hawkswell. I'm here with a delegation of patients and healthcare practitioners in Ottawa this week, coming to the nation's capital to advocate for medical psilocybin regulations. Medical psilocybin is the active compound in a variety of species of magic mushrooms and has been proven through a variety of different clinical trials to be safe and effective treatment for end-of-life distress, anxiety, depression, and a number of other mental and physical illnesses. We are here today to try and seek compassionate access for Canadians who have access to medical assistance in dying, but do not have access to medicine that could be life-affirming and help them. We encourage members of Parliament, the government, our ministers to look at medical psilocybin access in the context of the Canadian healthcare system, which is allowing for things like MAID, and where other medications such as cannabis, access to MAID, abortion, safe injection, are all accessible through our Charter 7 rights. There's an ongoing court case. We are here to try and put an end to that court case, to work with our government to find a solution in the form of medical psilocybin regulations. This is the first non-partisan debate or conversation and press conference to discuss this, and I'd like to pass it over to Janis Hughes, a Canadian advocate, to talk about her experience.
Okay, I would like to apologize. I'm
Janis,
Oh.
turn off your mic.
Is mine on? Yep, okay. I apologize, I'm not all together today because I over-imbibed coffee yesterday, which, unlike psilocybin, is an addictive substance, and it has a lethal dose. That said, I am a stage 4 breast cancer patient who learned of my recurrence in 2021. I was struck dumb. I went into a kind of paralysis and a thought mode pattern. I was just thinking, I'm dying, I'm dying, I'm dying, I'm dying. It colored absolutely everything. My family took me on a long cherished trip, and I couldn't enjoy it because I was looking forward to treatment and prognosis of, at that time, 2.5 years. So I just happened to discover that summer, around the time of my diagnosis, that there was maybe a solution. I learned about the studies that had been done at Johns Hopkins dealing with people exactly like me, end-of-life cancer patients, and that psilocybin actually was very effective in curing them of their anxiety. So this, I just started on a massive research process, and I came across TheraPsil, which was offering me therapy. It was offering me access to a trained therapist, which is what I wanted. I didn't want just the drug. I wanted the whole framework of therapy with a person, a reputable person whom I could trust. TheraPsil was offering me that, but on the condition that I got approval from Health Canada. So I embarked on the application process. Health Canada denied me my Section 56 exemption on the grounds that they had just brought in this new pathway, which was the SAP, and they advised me that I had to exhaust these other pathways, which were the clinical trials or the SAP, before they would consider a Section 56 exemption. So I'm from Winnipeg, Manitoba. There are no doctors. There were no doctors at the time that were prepared to embark on the special access program process. I asked my 2 cancer care providers and my GP. They all refused. So I went back to Health Canada and I said, this just is not viable for me. There are no clinical trials here. would you please reconsider? They said, fine, but we need you to reapply. So I reapplied, and as of today, I still have not had a response. They told me they were reconsidering, but I've had no response. My anxiety, which had abated somewhat with the prospect of this treatment, came roaring back when I lost 3 people in my circle within the space of 2 weeks. Before that, I had gone national with my story, and that had surfaced a therapist. She emerged out of the shadows to say she could help. So after initially saying I wanted to do things the right way, when I had this second crisis of anxiety, I just said, that's it, I can't afford to wait any longer. So I went underground. I had 2 unsanctioned psilocybin trips, which made all the difference in the world. It completely altered my relationship to myself, and they banished my fear of dying. I no longer fear dying, but I'm not in any hurry to die. I am living more fully than I ever have in my life, and I am just dismayed that my government would rather I live with the end-of-life anxiety or just opt out entirely by taking MAID. It feels cruel, thoughtless, just the opposite of empathetic, and just very disappointed in my government. Anyhow, because of this, because of my belief that this therapy stands to benefit so many people, I'm eager for it. I'm eager to be able to offer it to all of my law-abiding friends who are unwilling to take the route that I did, and people who still have irrational fears of this medicine, which is quite safe. Psilocybin is one of the least harmful substances known to man. Anyhow, I'm probably going on too long, but because of all of this, I joined the Charter Challenge. I am one of the plaintiffs that is challenging the government on its psilocybin, on its prohibitions of psilocybin, and I'm looking forward to a productive outcome, a positive outcome.
Hello, my name is Dr. Valorie Masuda, and I'm a palliative care physician. I work on Vancouver Island in British Columbia. Prior to 2 years ago, when psilocybin was accessed under Section 56 exemption, I worked with patients, terminally ill patients, with a lot of existential distress, and we had no options available to them to alleviate the distress. Antidepressants and anxiolytics do not work in this population because they're dying. And their distress really prevents them from being able to live the rest of their life, to connect with their family and friends. And they become this ball of suffering. And it is distressing also for the care. We have moral distress caring for these patients as well. We used to actually put them in a form of terminal sedation because they could not bear living anymore with this kind of distress. And we used to put them in a deep sleep as they neared their dying time and would allow them to die naturally, but under deep sedation. In 2016, medical assistance in dying became legalized, and I have been a medical assistance in dying assessor since that time and have supported patients in their applications for MAID and have been witness to many MAID deaths. When 2 years ago, I had a patient who was in extreme existential distress, and she could not be managed, her pain could not be managed, nor her distress managed by even tertiary care palliative facilities. And I connected with Bruce Tobin, who is the CEO of TheraPsil, and together we managed to support this patient with her Section 56 exemption for psilocybin. I had no experience with psilocybin, but I had read the data and I had read the clinical trials that had been performed before then and felt this was her only hope for a peaceful dying time. And so we treated this patient. She obtained a Section 56 exemption under Minister Hadju, and we treated her, and her transformation was so remarkable that she died with peace. She died connecting with friends and family. She died with remarkable pain control. So I was transformed as well, thinking this is a valuable, essential tool for palliative care. Over the past 2 years, I've supported close to 25 people with either a Section 56 and under the Special Access Program through a program of supporting them. They're all terminal illness patients, and we have about a 75 to 80% success rate and reducing marked reductions in existential distress, depression, and anxiety. Unfortunately, in the summer, I was told by the Special Access Program I can no longer access psilocybin for my patients because I'm treating too many people. Even though they all qualify, and even though myself working with Roots to Thrive, a Society for Psychedelic Therapy, we are the most experienced delivering psychedelic assisted treatment to terminally ill patients under the SAP program, they said we're treating too many people. And so we would have to access, my patients can now only access under a clinical trial. So myself in this nonprofit group is struggling to run a clinical trial without any funding. There's no funding available from the federal government or the provincial government for supporting this clinical trial. So my patients now are unable to access psilocybin except in the underground. And we have to recognize that many mental health patients as well as terminally ill patients are accessing psilocybin in the underground with unregistered therapists, with no medical direction. And so we're looking at what are we going to do to protect Canadians who are now trying to access psilocybin to relieve their pain and suffering? How can we regulate access to this very, very safe medication so that people suffering can be alleviated in the overground with proper medical supports and mental health supports? Right now, the situation is unsafe. Thank you.
Wonderful, and maybe we'll move over to Elizabeth May.
Merci tout le monde, merci Spencer et aussi Janis et Valorie pour votre courage dans cette situation affreuse. On doit changer le système de santé publique au Canada pour l'accès au psilocybin pour les personnes qui souffrent les maladies physiques et aussi dans la santé mentale. I don't think there's any real question that there's medical literature there. Psilocybin makes a difference in a number of ways, which you've heard about, between alleviating the stress and anxiety for patients who've been told they're terminally ill, but also for people suffering from what might be considered an irremediable mental health issue. We just were debating, and we are still debating, Bill C-39 to extend the deadline for the access to medical assistance in dying for patients who are experiencing chronic and unbearable suffering from mental health issues. We have a year coming up, and I said in my speech last night in the House, in that year, let's advance our clinical trials. Let's increase access to psilocybin and develop the medical research. I'd hate to think that we opened the door to something that may be medically necessary. I'm not saying it's not, to expand medical assistance in dying to those suffering from mental health issues. But how do we do that if we've turned our back on a possible cure? To say that someone is incurable while refusing to look at a cure strikes me as beyond, as Janis said, lacking in empathy. It's building a wall of ignorance. I'll turn it over to Alistair MacGregor.
Thank you very much, Elizabeth. Hi, everyone. My name's Alistair MacGregor. I'm the Member of Parliament for Couch and Malahat Langford, and I'm actually lucky enough to count Dr. Valorie Masuda as a constituent. And I've been working with her and with Spencer, and of course with all of the patients that they have been supporting in this process. I've also been a member of the Special Joint Committee on Medical Assistance in Dying. And, you know, our committee was tasked with studying 5 key themes, one of which was palliative care and, of course, mental disorders as a sole underlying medical condition. And I guess the way I see this, apart from the court challenge that's going on, my role as a parliamentarian in supporting my constituent is to be an advocate and to really, show Health Canada that there's promise here. There's promise in helping people deal with trauma, dealing with existential dread at the end-of-life care that they're receiving. And I know in my own community, there's a real mental health crisis. A lot of people are turning to opioids to deal with underlying trauma and underlying mental health issues. And from what I've read, the research shows so much promise. And I think that if that promise is there, we have to nurture it. We have to nurture it in a coordinated way with resources. And that's where Health Canada steps up. So I think the fact that you see Elizabeth May and myself here today shows that we are here to be advocates for our community members, especially those who are dealing with very real life problems. And if this is a therapy that can help them navigate that incredibly difficult part of their life, then I am more than happy to be here to stand in support. So thank you very much.
Merci, thank you. We'll now go to question periods. If you are attending on Zoom, you can use the raise hand function at this moment, and I'll hand you the mic in a few minutes. First in the room, I wonder if you have a question, David? Can you go ahead? Was that? Yeah.
Yeah, thanks. I'm wondering, in other instances, for example, with cannabis, legalization took lots of court precedents and decades of medical trials. I'm wondering if one of you can explain to me why psilocybin should be any different and why we shouldn't go through this process of having years worth of medical trials and court precedents before we decide whether or not this should be readily available to people.
Yeah, I'm happy to answer that. I mean, in Canada, we're very fortunate to stand on the shoulders of giants such as Carter, Parker, the very brave Canadians such as Janis Hughes and the other plaintiffs on the case that stood up for their Section 7 rights. I believe if you look at the precedent in the case law that we have as a result of our access to safe injection, medical assistance in dying in cannabis, it becomes very clear that what's there is this obligation through our charter for our government to allow doctors to act as gatekeepers and to be the ones determining what makes sense for a patient, and also to give that patient medical sovereignty over what they're accessing. So what's going on right now does seem to be a government that wants to block things and is putting up a challenge. But I do believe that there is a win here, and I believe that the best thing to do would, instead of fighting for many years, perhaps 20 years, to just look at the law that we do have and to work with patients and healthcare practitioners to find a solution. And that is why we're here. We do want to put an end to that charter challenge.
Can I just, for one brief moment, say that I don't think, at least speaking for myself, I'm not imagining a world where psilocybin is as available as cannabis is today. We're not making the case for legalization. We're making the case for access for specific patients who desperately need. And I shouldn't speak, I'm not an expert, I'm not a doctor, but from what literature there is, and we need to do more research. But to get that research done, we need to make access available to patients whose doctors are there to help them, with registered therapists who know how to administer psilocybin and achieve what appears to me, and I don't want to go to, but I've heard stories, and it's anecdotal, but the change is not just a small change in one's level of depression, but an absolute cure, like a miracle. I don't see why we wouldn't want to accelerate our research efforts and make sure that by March 17th, 2024, we have a better answer for people suffering from mental illness. We need a lot more resources. It's not just one solution, but we really have to open up access to psilocybin, and that will help us develop the data.
Before you can, I'm also wondering, just specifically, what are you looking for here? Are you looking for a return to those Section 56 exemptions? Are you looking for more funding? If you could expand on specifically what you're going for.
Sure. I mean, if Section 56 exemption is the government granting an individual compassionate access to a drug, And so this isn't like a clinical decision. This is patient requesting compassionate access. The special access program is designed for a physician to request access to a drug for a patient, to treat a patient. So, but it is not designed for psilocybin. It's designed for medications used to treat patients with cancer that are not available in Canada, or other life-threatening conditions. So with psilocybin, this is a little bit different, where we're no longer really seeing the patients. Patients certainly want to advocate for access, but it's the clinicians now. It's physicians, it's therapists, it's psychiatrists who are asking. They're saying, I know as a clinician, I have read the research, I have been trained. I want access to this very vital medication, which I believe is really the only medication that's going to be effective for my patient. This is a clinical decision by clinicians with experience and training. That's what we're asking for. We're asking for, we as clinicians, having access for our patients.
Sorry, in terms of the efficacy of psilocybin, all of the solutions we have currently for mental health address the symptoms. Psilocybin gets at the root causes, and this is revolutionary. I do believe that it's going to thoroughly upend psychiatry as it's currently practiced. And here every day, I see Minister Bennett publishing on Instagram messages about mental health and the dire need in mental health. And I just want to scream at her, psilocybin, it's here, it's in front of you. Let's look at it, let's treat it seriously. And maybe there is reason to fast track a little, because there is so much need. The need is growing. We know it's growing and expanding every day. I'm passionate.
Do you want to go first, Alistair?
Yeah, I don't know if I can comment yet on the political appetite. I mean, I think this part of this week is to reach out to other parliamentarians, not only members of Parliament, but members of the Senate as well. And on the policy side, I think some of the roles that Elizabeth and I and other members of Parliament can take is looking at existing acts like the Controlled Drugs and Substances Act and the regulations that are made under that, and see if there are some policy fixes that can be done through legislation. At the same time, we have access to not only the Minister of Health, but the Minister of Mental Health and Addictions every day in the House of Commons. And so we, in addition to the letters that I have already written, we can, you know, bring that message face to face. And I do realize that, you know, for some people there are still doubts, and but what we're asking for is that if there is a promise that this therapy is doing some incredible things for patients, and we've got a real life example right here, a real advocate who has gone through it and is explaining on her own terms what a life-changing decision that was. If we can look at those real world examples, those real life examples of where this therapy has worked, I think that begs the question as to why is Health Canada not stepping up, providing the resources for better research. But, you know, what I have found personally so onerous is that, you know, we've talked about the Section 56 exemptions. Those are on a case-by-case basis, and they've been extremely onerous, requiring us to go patient by patient. And so we're just trying to find ways to make it easier. I'll end there, and if Elizabeth wants to add anything else.
If I just wanted to jump in on that too, I think the political appetite is real and urgent because of medical assistance in dying, because we expanded last session of Parliament in Bill C7 that on a deadline by default, which would have been next month, medical assistance in dying would be available to people suffering from irremediable mental health conditions. And of course, Alistair's been working on those committees. I think right now we're up against it. And if you want to know who I think our opposition is in looking at psilocybin, Big Pharma. If there's a cure for depression, it shuts off a market for some very profitable products. SSRIs, people who are, there are a wide range, Prozac. The pill pushers in this country, there are 4 drug salesmen for every doctor. I think we need to take our blinders off in terms of where there are entrenched interests that would not want to see people having access, especially if it works. So as Janis just said, the other drugs that are put forward for people suffering from mental health conditions dull the symptoms, dull the pain, distract people from the pain that they're suffering, and it's real pain. If there's a cure, then the pill pushers and Big Pharma are going to lose a lot of money.
I see no hands on Zoom right now. Je pourrais peut-être poser une question en français. Boris Prou du Devoir. Je voulais savoir, est-ce que vous excluez de faire un projet de loi? Si j'ai bien compris, il n'y a pas de projet de loi pour l'instant qui est planifié.
Maintenant, actuellement, nous sommes dans le débat sur C39 et la question là, c'est simple et je pense que le vote sera unanime en faveur de C39 parce que sans C39, le régime pour assistance médicale à mourir va rentrer pour les personnes qui souffrent avec les maladies mentales dans le mois de mars 2023. Et je pense que c'est une grande majorité des députés qui pensent que ça, c'est trop tôt. Nous ne sommes pas à ce moment prêts. Mais dans le débat sur C39, c'est presque personne qui mentionnait un autre course, la question de psilocybin. Je pense que c'est peut-être seulement Alistair et moi qui a parlé des questions de les alternatives pour trouver une solution pour les gens qui souffrent. Et les souffrances, c'est tellement dur, ce n'est pas une chose, on peut dire, ce n'est pas, c'est vraiment grave dans la santé mentale. Mais j'espère que de ce débat, élever le niveau de connaissance, que peut-être nous avons les solutions et les autres thérapies comme psilocybin. Ça, c'est votre question, Claire?
Un peu.
Un peu.
But on your side, Mr. MacGregor, is it possible that this translates into an NDP bill, for instance, in the coming months, years?
Well, I would want to ensure that any work on that front is being done closely with stakeholders. But I will say this about private members' bills in general. They can serve as a fantastic catalyst that you can build a campaign around because you can provide a real and tangible example to the government on how to do it. And once you've got a private member's bill in place, this can be for any issue, really the best compliment a government can pay you is if they see merit in it, they could just adopt it into a government bill, which assures its progress. So yeah, I mean, we will consider that as a part of our campaign. I think it's a campaign with many different facets that are going to involve a lot of stakeholders on the ground. But as a member of parliament, I'm always looking at every single tool I have at my disposal. That can include private members' bills, it can include motions, it can include debate in the House, it can include my role at committees. They're all on the table for an issue like this because I understand the passion of the people involved and I have seen the examples of the promise that this offers. So that's why I'm here today.
I just saw that on Zoom a hand rose, so I'll hand it over to Palak Mangat.
Hi, thanks for taking our questions. I think this question might be for Ms. May, but if others want to chime in, please feel free to do so. We've heard a lot about sort of a lack of safeguards in the MAID regime so far and how it's being rolled out. And Ms. May, you said that that makes the case for greater access to psilocybin. I guess my question is, what is the best case scenario in your mind, in a year's time when it comes to access for psilocybin? You mentioned not legalization, but greater access, but just sort of walk us through that a little bit.
Thanks, Palak, and obviously everyone else might want to comment on it. It's not a clear path with just one solution. So again, in terms of medical assistance and dying being made available to people whose the cause of their suffering is exclusively from a mental health issue, there is a need to eradicate poverty. There's a need to ensure we're advocating in the Green Party for a guaranteed livable income. We need to make sure that there's also better access to palliative care for every patient who's looking at MAID, regardless of what health condition takes them to that spot. There are numerous things that need to be done in the next year. And of course, more conventional mental health supports, more access to therapy, more addictions counseling. This is clearly we need to think about parity between what we're spending on traditional medicine, if you put it that way, and with where we invest in mental health supports. So psilocybin is not the exclusive one answer for what we need to do. But we have a year, once C39 passes, we have a year till March 17th, 2024. Now, unless the whole regime is overturned and there's a decision to withdraw access, the promise of access to MAID for people suffering unbearable pain from a mental health condition, in that year, we have an opportunity to have Health Canada invest in all the things that Dr. Masuda has mentioned, more clinical trials, more evidence gathering, more investment in more physicians able to support patients, collect the information, collect the evidence, and make it, right now to access psilocybin, as I understand it, people have to be willing to go through shock therapy and drug treatments that are particularly invasive and unpleasant. We should never find ourselves in a situation where we've made it easier for a patient to access MAID than to access psilocybin.
If I can also speak, I think when you offer medical assistance in dying to people with intractable or chronic mental illness, you have to also realize that people with chronic mental illness also are often, I would say very often, suffering from an inability to work, that they often are suffering from substance abuse. They may also be suffering from poverty so really they are suffering from the inability to access the social determinants of health. We cannot be a country where we promote medical assistance in dying or support medical assistance in dying for those who cannot actually access the social determinants of health. And for me, that is the big red flag for MAID for mental illness. Thank you.
A follow-up, Palak?
No, I'm okay, thank you.
Ceci met un terme à la conférence de presse. This puts an end to this press conference. Merci beaucoup à tous. Bonne journée.